Hi guys, hold on for a second. Before we proceed to the video, I have something very important to tell you. Professor Jon V. Kofas has published his new book in collaboration with Little French Media, and the title of the book is Neoliberalism, Inequality, and Authoritarianism. This book details how neoliberalism impacts the geopolitical economy in the 21st century. You can buy it from Amazon, and the link is in the description. Thank you. Now let's proceed to the video.
Hello, everyone. Welcome to an analytical session on the crisis of the American healthcare system in light of the fact that the Trump administration is currently working on massive cuts of Medicaid, which is a program designed to serve the bottom tier of the social class in American society. It is estimated by analytical studies that those who, if the United States does cut Medicaid, as well as targeting Medicare, which is for the rest of the retirees in American society, we are looking at a problem that is very serious, as many as 1/3 of American hospitals will go out of business, out of an estimated 6,000 hospitals. The crisis of the healthcare system in America is really a crisis of the neoliberal political economy, whose foundations started out in the late 1970s during the Jimmy Carter administration. But Jimmy Carter did not institutionalize neoliberalism. It was the Reagan administration, after Margaret Thatcher, Prime Minister of England, started the neoliberal political economy in that country in 1979. And then Reagan was full speed ahead with neoliberal programs. Neoliberalism essentially means, above all, weakening the welfare state and the social safety net of American society as it was formulated from the time of the FDR administration in the 1930s during the New Deal amid the Great Depression, through the Great Society of LBJ Lyndon Johnson in the 1960s. The social welfare state was set essentially as an essential safety net, providing everything from Social Security to some medical assistance in the form of Medicare and, of course, eventually Medicaid for the poorest American in a capitalist economy where capital flows from the bottom up, from the working class and the lower middle class to the very rich. Under neoliberalism, the program policy shifted to transfer hundreds of billions dedicated to the social safety net, and instead pour that money into capital, and in fact, not just what in economics we call horizontal development, capitalist development, but rather vertical. In other words, strengthening the strongest within the capitalist system. This starts with Reagan, but it was in fact embraced by both political parties, both the Democrats and the Republicans. In fact, under Bill Clinton in the 1990s, we see a great deal of neoliberal tilt in policy. And it does mean, by the way, besides shifting that money from the social safety net, it also means privatization of public assets. giving out contracts, government and public contracts from all levels, from the federal level, state level, local level, giving out contracts to um, local private contractors or national contractors, rather than having public firms do the exact same job at a much higher cost, by the way, to the taxpayer. It also means privatizing public assets, giving them for pennies on the dollar to private companies, private sector. Above all, it means massive bailouts. We see this with the savings and loans in the 1980s under Reagan, all the way to the Great Recession of the 2008, when there were massive trillions of dollars in government bailout of corporations, from banks to insurance companies to other corporations. So this is taxpayer money poured into private capital to buttress capital, private capital. It also means, it has meant in the last 50 years, 45 years or so, I should say 45 years, it has meant massive corporate subsidies in everything from the pharmaceutical industry, where the government provides funding, taxpayer money, in other words, for research and development for new drugs and vaccines and so forth, although without strings attached, that the pharmaceutical companies put caps on what they sell those drugs and vaccines back to the public. In the United States, of course, it's no secret, as we'll see, the United States has the highest cost in drugs. No country pays as much as the United States consumer. The other element of all this is, of course, that the United States spends roughly 20% of GDP, roughly 28 trillion at this point, I believe 28, close to 28 trillion GDP on the entire healthcare system, everything from drugs to hospitals, clinics, and so forth, everything related. 20% of GDP is the highest in the world, by the way. Now, if the US got something out of, I shouldn't say the US, if the consumer across the board, if the American people had a quality healthcare system, one could say, well, that's okay. The 20% of GDP is worth it. But the fact is that only a segment of the American population benefits from this system, namely the segment of the upper middle class and the wealthy. The United States has the costliest healthcare system, but in terms of accessibility to quality health, that is limited to those with the means to afford it. So, and as I'll just give you an example, as the incoming Prime Minister of Canada, Mark Carney, pointed out recently in his speech, I believe on March 9th, in response to rejecting U.S. calls that Canada become the 51st state. He noted, why would we want to do that? We have universal health care that's free to our citizens. It's not free. Everybody pays for it through taxes, of course. But we have universal health care. We regard universal health care. We regard health care, period, as a human right, as do most countries in the world. In the United States, healthcare is not a human right. Healthcare in the United States is a business, and it's no different than investing in high tech. It's no different than any other business. So the most vulnerable people, namely the sick, whether in an emergency care, in emergency room care, or whether undergoing surgery, those people are in fact exploited by profiteers, as we will see. Um, especially, I will especially focus today on private equity firms, which take advantage of this most vulnerable population in America, namely those who need medical assistance in some form or another, and they profit off these people with government, not just government acquiescence, that is, government permitting this instead of regulating and not permitting the exploitation of the ill, but and those dying, actually, by the way, as we'll see, the U.S. has one of the highest death rates in the world, um, because of its poor health system, and one of the lowest life expectancy rates. Cuba has a higher rate, life expectancy rate than the United States, and Cuba has been under sanctions since Fidel Castro's revolution back in the late 1950s. This gives you an idea of how horrible this healthcare system is, and yet it absorbs 20% of American GDP, which, by the way, in nominal value, US GDP is the highest in the world, followed by China. Now, healthcare is the healthcare perspective. Let's look at ideology for a second. Is a matter of a value system. The question is, what do the elites in the United States value? And as the the incoming Prime Minister of Canada pointed out, Mark Carney pointed out, Americans don't value, the American elites do not value their citizens' health care. They don't value their, if they did, they would not treat it as a business to be exploited, no different than selling cars or any other commodity. It's not a human right. So the ethical foundation of the American elites exploiting the healthcare system for profit, and the government, which of course is heavily influenced by healthcare lobbying. I should point out that when you put together all the healthcare lobbies in Washington, they constitute the largest, collectively, the largest lobbying group in Washington. They have enormous influence. They spend a lot of money um, to influence public policy to make sure that the healthcare sector remains a business, not a human right. They have systematically blocked any efforts to um, go along with many countries, including their neighbor to the north, Canada, uh, to view healthcare of their own citizens as a human right. Now, I should point out at this juncture that the United States, of course, argues that it has quality healthcare and some of the best doctors in the world, and that's all true. No problem. Except for one thing, its accessibility is limited to those with heavy wallets. That's the issue here. It is not that there are not fine hospitals, fine doctors. It is not that some of the best pharmaceutical companies in the world are based in the United States. That's not the issue. The issue here is very simple. There are close to 350 million people in the United States, and the question is, are they all served by this system, or is this healthcare system serving the upper crust, namely the upper 30% of the population? Because as we will see, the medical debt, as well as household debt, which, by the way, a lot of people convert some of that medical debt into their credit card, so it becomes part of the household debt. The household debt in America has been rising very rapidly, in part because of healthcare costs. So what we have is, in fact, a crisis, and because the value system of the elites is capital accumulation, not the health of the American citizens, Again, this is part of a systemic crisis. This is not something in isolation. The neoliberal political economy um, is ubiquitous. It operates in every sector, from higher education to housing to everything. It absorbs, even churches, by the way, it absorbs all institutions. So this is part of an institutional crisis. Now, the apologists of the neoliberal political economy with regard to healthcare, to the healthcare crisis, and they admit, by the way, there's a health crisis, but their solution is that there must be more cuts in what they call waste. They don't regard corporate welfare, U.S. citizens, taxpayers, paying out of their pockets to support corporations in the healthcare sector, and private equity firms investing in, as we will see, in hospitals and destroying some of those hospitals, driving them into bankruptcy. They don't regard that as a problem. They don't regard regulation to curtail profiteering as a problem. They argue that there must be deeper cuts in Medicare, in Medicaid, and Medicare. Hence, the Trump administration's current drive to, and the GOP, of course, the Republican Party, to take out close to 1 trillion out of the Medicaid program, which, by the way, will hurt the bottom 50% of the population, including, as those who have been following stories about the Medicaid issue, many veterans who have been showing up in town halls of their congressional representatives and yelling at them that they have served their country as veterans, and now they're being thrown out as a result of the deep cuts in the Medicaid program, and having to endure with mythology that apparently the system is so abused in everything from Social Security and 300-year-old people. Yes, 300-year-old people. When I heard this in a Senate floor debate, I was amazed that Republicans actually believe that there are 300-year-old people collecting Social Security and abusing Medicare. In any case, the idea is, so the apologists argue this is the problem. We have to cut Medicare, Medicaid, as well as Social Security. Now, why would they do this? Because there is a current bill that has passed the House, by the way, to cut 4.5 trillion, most of it, by the way, going to tax cuts, and most of that, 2.3 trillion, in fact, going to the richest Americans, the top 5% of the American people. Now, there are three people in the United States, all three of them were standing behind President Trump at his inauguration. Those three, yes, those three, own more wealth than the bottom 50%, many of them, of course, on Medicaid, which the administration wants to cut. So you have three people versus 175 million people who own more wealth. The three have more money than the 175 million, and yet the government wants to take it out of the 175 million and give it to those three and others like them, billionaires and multimillionaires. And as Warren Buffett points out, as though we need it, we're billionaires already. So this is a As Senator Bernie Sanders has pointed out, it's a matter of greed. It's a matter of sociopathic behavior to want to, and misanthropic tendencies. It goes right into the psychology of the elites with these sadistic tendencies, and this has been done in history in other eras. The great Dutch scholar Johan Huizinga pointed out that the elites, in their desperation to amass greater wealth, become sadistic and misanthropic. And Huizinga was absolutely right that indeed we have here um, a handful of people who have more money than they would need in 100 lifetimes, who want to take the crumbs from those at the bottom of the socioeconomic scale and give it to themselves in the name of cutting waste and fraud. Um, Now, all of this came to light. Some, I shouldn't say all of it. Some of it came to light when the Trump administration put forward the nomination of Stephen Feinberg as Deputy Secretary of the Defense. Now, Feinberg he has nothing to do with defense. He actually is the CEO of a private equity firm, which, yes, invests in, you guessed it, the healthcare sector and hospitals. And when he came before the Senate committee for confirmation, Senator Elizabeth Warren exposed his firm, which is its capitalization, by the way, is between, I've seen between 35 billion and 65 billion, and it's a good size. It's a good size private equity, and it's also an investor behind other equity firms, also in the healthcare sector, also in hospitals. And one of the things that struck me during the senator's questioning of Mr. Feinberg, who is just a private equity person, he's a finance person, is that he had driven a hospital in Boston into bankruptcy. Not he personally, the private equity firm. This is not Feinberg's fault, by the way. I'm not defending Feinberg. I'm just saying that the fact is that the neoliberal system is what permitted Mr. Feinberg to set up this firm, private equity firm, to invest. This is called distressed investment in hospitals that needed capital to go in, um, invest in the hospital in a leveraged buyout. Now, the interesting thing is that leveraged buyouts usually work in a very simple way, and they existed before the neoliberal era, by the way, and they work very simply. The capitalist doesn't put up much of either very little or none of his her own capital, the firm's own capital. They use the assets of the firm they're buying, the hospital in this case, of course, to buy out to get a loan and to invest in that firm. And then they proceed to make deep cuts in everything. When I say everything, I mean the best qualified doctors, reducing uh, the physicians and using physician's assistants. Some of you living in the United States know about this. You go for an appointment and the doctor doesn't even see you. The doctor comes at the very end and checks on the physician assistant, who is a highly trained healthcare professional, but not a medical doctor. Um, so what you have is the reduction of staff. They reduce the nursing staff. They reduce the staff, period. They also often not pay, by the way, their suppliers. They reduce the expensive medical machine. Medical equipment, by the way, is very expensive. They reduce the medical equipment. They often do not pay their taxes. They got the hospital's assets. However, as Elizabeth Warren pointed out to Mr. Feinberg, when she asked directly, how much have you, during the time that you were involved in this business, tell me what you paid out to your own investors, 24% annually. 24% return on investment is a very good return, by the way, considering what the banks are paying. But what did you give to your own, to the nursing staff over at the hospital? So this is a very important issue. Now, however, it's even more egregious than that, because typically the private equity firm's goal is to gut the hospital, get as much profit out of it as possible, and then get rid of it, sell it to another private equity firm, which comes in and continues to derive as much as it can out of that entity until they drive it out of business. And this, of course, means reduction in services. And I'll give you, I think I have compiled some statistics on the US versus the world in terms of services at hospitals, including emergency room services, by the way, which some of these equity firms go after because those are high profit. There are high profit margins there. Now, one of the big issues in the last 10 years has been hospitals filing for bankruptcies after they were taken over by private equity firms. One of the largest is the Steward Health Care private equity firm, in which, of course, Feinberg Cerberus, which it's a Greek word, a classical Greek word, Cerberus private equity firm had investments in that one. That one happens to be the largest private equity firm, by the way, Steward Health, in the United States, investing in hospitals, and the most controversial. And I'm not going to go deeply into it because we don't have much time for that. But if you look at, if you research this, what you find is that they own more hospitals than any other private equity firm. And the most controversial because they drive many of the hospitals close to bankruptcy or to bankruptcy. Although they have defended themselves, they have argued that we are trying to save hospitals and so forth. The reality is that the record, and by the way, Harvard Medical School has done an empirical study, among other studies that have been done. It's not just Harvard Medical Center, but I'm mentioning that because that's one of the most prestigious in the United States. Empirical study showing that private equity firms do a huge disservice to the American, as they call them, by the way, they call patients American consumers. So this is consumerism in healthcare, as though you're buying tomatoes or you're buying a bicycle. Healthcare is not like Prime Minister Carney pointed out. We Canadians look at healthcare as a human right. We don't look at it as a business. We don't look at the patient undergoing heart surgery as a consumer. This is the absurdity of the neoliberal value system reducing a patient undergoing surgery or in the emergency room undergoing any procedure, doesn't matter what it is, as though that person is no different than someone buying a laptop. So this is, again, this goes to the heart of what the neoliberal ideology values. And this is not, by the way, I disagree with many critics of the neoliberal healthcare system that this is about people who are not intelligent enough or who are misguided or who don't see the errors of their ways and so forth. Um, this is really about one thing and one thing only, and it is about amassing as much profit as possible, regardless of what happens to human life. That's what this boils down to. And in this sense, of course, both Elizabeth Warren and Senator Sanders are correct that this is what they're playing with. They're playing with human lives here, because those people at on the operating table, those are the most vulnerable, or in a hospital, but they just want to get well. Um, the other thing I should point out, by the way, in terms of vulnerability, it's not just operating room, is that these private equity firms and going into hospitals buy drugs at a discount on block, in other words, a lot, in, in volume, and overcharge, I should say, patients, which then are unable to pay. And this is one of the reasons that the United States has a huge medical debt in comparison. For example, let's look at the world's second largest economy, China. 8 times less. China has 8 times less medical debt than the United States. Why? Because they have a medical system, they have a healthcare system that is geared to serve the Chinese citizens, not to exploit them at their most vulnerable position. The the issue of the issue of the private equity firms um, brought out, and again, partly because of the Senate hearings with Mr. Feinberg, brought out some disturbing statistics with regard to the healthcare system. It has nothing to do with Feinberg. If it weren't Feinberg, it would be somebody else. There are a lot of others who are doing the exact same thing. Uh, this is not about any individual, by the way. I want to make sure. I'm a structuralist. I believe that systems are the ones that need to be addressed. Individuals are not the issue. Um, the problem here is that the United States has some structural problems, and we start with preventative care. The U.S. has some of the highest rates of preventable diseases on the planet. And especially among OECD countries, that is Organization of Economic Development Cooperation countries, um, and some of the highest within that group of infant mortality, highest suicide rates, um, highest maternal rates, um, highest rates in treatable diseases. Why? Why is this? Because the cost is prohibitive, because universal health care doesn't exist in the United States, because of the Milton Friedman, the neoliberal godfather, down at the University of Chicago. There, when I was in the PhD program, he was preaching the gospel of neoliberalism back in the late 1970s, and he was an advocate of this sort of system. And of course, that means that if you got money, you buy it as though it's tomatoes or some other product. Well, this is about human survival. This is about human health. And if a society, if the elites in society have a social contract that doesn't value the lives of their own citizens, then there's something wrong, as the great father of liberalism, John Locke, the philosopher, great in terms of a brilliant man, although I strongly disagree with his liberal political philosophy. As John Locke, the English philosopher, pointed out in the 17th century, if the system veers toward tyranny, as it has, by the way, in the United States, because this is a tyrannical system, the healthcare system in the United States, neglecting the bottom tier of its population, more than 50% of its population, and wanting to gut even more, close to $1 trillion out of Medicaid alone, and they're going to go after Medicare as well. That is not a social contract that is based on social justice. That is not a contract that is based on respect for human life. That is a misanthropic social contract. That is something that needs serious examination. The United States has the lowest hospital beds for 1,000 people among developed countries and semi-developed countries. It has the lowest routine examinations, from breast cancer examinations to colon cancer and so forth. It has it ranks 48th in the world in life expectancy, below Panama, which the United States wants to take its canal, by the way, by force. Panama. U.S. considers it a third world country, and yet Panama has a higher life expectancy than the United States. Okay, although the United States has the highest cost in prescription drugs, those who can afford them abuse them. The U.S. is 4% of the world's population. We have 8 billion people on the planet. The U.S. is about 345 million people. Out of 8 billion, it's 4% of the population. It actually consumes twice the percentage of its population. In other words, 8% of prescription drugs, and it's the largest consumer of illegal drugs, illicit drugs. Okay, and yet it's the fault of those exporting them, not the U.S. drug culture, okay, or the culture, as medical professionals call it in many scholarly articles in medical journals, the culture of therapism. Okay, take this drug at a high cost, of course. The U.S., in terms of structural, because I started going down the road and saying this is not about individual, this is the system, this is the neoliberal system. The U.S. has the highest medical debt, which is transferred down to household debt, okay, and household debt in the world among advanced capitalist countries and semi-advanced countries. Semi-advanced countries, as I pointed out earlier, 8 times higher than China. Okay. The U.S. also has had, according to OECD statistics, Organization of Economic Cooperation Development, the U.S. in the last 45 years since Reagan took over has had a doubling of its healthcare cost in comparison to all OECD countries, and yet a huge drop in the quality of that service and a drop in who benefits from it. This is the contradiction. Double in cost, drop in who benefits from this healthcare system. And the interesting thing is that all along, by the way, the United States has um, has been arguing that it is making it is very proud of its medical sector. It is a revolutionary country in terms of providing new great drugs and so forth. Although the same drug sold in the United States, again, as Senator Bernie Sanders has pointed out, may be selling 10 times less in the in the north in Canada, the country to the north that the U.S. wants to annex, by the way, or in Portugal. So we have a huge profiteering system here, and one of the reasons is because the lobby, the healthcare lobby, the healthcare lobby is very powerful, along with the U.S. defense sector lobby and the Israeli lobby. These are very powerful lobbies. They conduct policy that impact the lives of the rest of Americans. And like I said, as the father of liberalism, John Locke, pointed out back during the Glorious Revolution in the 17th century, when you have a government that does not serve the interests of the governed, where, where sovereignty rests with the people, not the elites. That's tyranny, by the way. And it is no secret that this system, this neoliberal healthcare system, is an integral part of the authoritarian trend that the United States has been following. The trend of silencing dissidents who dare speak out for a healthcare system as a universal human right. Let me point out, by the way, that the Canadian Prime Minister right now was the former governor of the Bank of England and an executive with Goldman Sachs. In other words, a capitalist to the core. And he, okay, argues that healthcare is a human right. So this is not the nonsense that the apologists of the neoliberal healthcare system point out. This is something that the leftists and the left liberals and all those progressives are trying to make an issue of. This is about life and death situations of people, like I said earlier, people in the operating room or trying to recover from some chronic, trying to get some relief from some chronic disease. And I should just give you another statistic I just read recently. And this had to do with, again, this was part of a debate on the Senate floor. One of the senators, I forget if it was someone from Oregon, in any case, pointed out that there are over 30,000 Americans dying every year. 30,000 Americans dying every year, waiting for the Medicare and Medicaid offices to make a decision whether they qualify for benefits. Meanwhile, while they're waiting, 30,000 of them die. This is a tragedy. This is nothing to be proud of. This is not something that would go under the heading of democracy. And let me add, by the way, that in the debate, in the Senate debates recently, with regard to slashing the healthcare system for the bottom 2/3 of the American people, they're starting with the bottom 50%, and then they're going to go even more, they're going to go deeper than that. This, what came out, is very clear that the healthcare system is fine if you're rich, if you can afford it. There's nothing wrong with the healthcare system in America. You can go to Mayo Clinic or Cleveland Clinic, Johns Hopkins University. Those are great medical facilities, fine. Who can afford that? So healthcare is inexorably linked to social class. It is not. It is not a human right. It is a commodity. No different than you want to buy a Lamborghini, go ahead. Can you afford it? Same thing. You want to get well? Can you afford it? Oh, you can't, you'll die. Or you will suffer a slow death. That is a tragedy for any society claiming to be the world's model democracy. When there is no evidence of social justice and human rights in the policies pursued. The rhetoric is great, fine, but the evidence is in the policies pursued, whether it's with regard, by the way, to healthcare, education, housing, school lunch programs, for example, for children that are poor, okay, and the distractions about migrants siphoning off resources, when in fact those who have studied the contributions of migrant workers historically in the United States know that those people have made enormous contributions to the American economy. They're the lowest paid and make the highest contribution to the capitalist sector, by the way, because they get the lowest paying jobs. Okay, and yet they become the boogeyman. They become the enemy, the distraction, when the real looting of America. I have to find. There was I think it's John Gaiman, a doctor at the University of Washington, who has written a number of articles, and he argues that the looting of America has been in healthcare system, and this comes from a doctor, has been carried out not by welfare mothers and children, who, by the way, the people in the working class who have to make a decision between putting food on the table or taking their children for the necessary medical tests, put food on the table, and they don't do preventative care. And hence, the U.S. statistics, in comparison to many countries many countries in the advanced sector of the world. By the way, the top countries in terms of healthcare are obviously Northwest Europe, especially Scandinavian countries. Canada is also in there, New Zealand, Australia. So those are part of that group. The United States ranks below Panama. This is the astonishing aspect of this. Private equity is an industry that has thrived. The United States rewards it. The United States government, that is, when I say the United States, I mean the government of the United States rewards it with policies. And it is not just the Republican Party, by the way. There are many Democrats who support and, in fact, have investments in some of these firms. So this is not an issue of one party, although the Republicans tend to be less humane when it comes to, more misanthropic when it comes to the issue of healthcare for all citizens. They figure, well, if you can afford it, go ahead. If you can't afford it, we know the result if you can't afford it. Healthcare for the rich is, in fact, has been a fiction in the United States, and the Trump administration recently, with its announcement of getting rid of the lumpen proletariat of America, the migrants, the working class people who contribute so much and gain so little, being forced out. The Trump administration announced that all those with $5 million to invest will qualify for citizenship. So in other words, they are advertising openly that the United States is not what the Constitution says. As, by the way, a number of congressmen and senators on the floor of the House and the Senate have pointed out, on the Democratic side, that this is an open society, to use the term of the European philosopher Karl Popper. This is an open society. What open society? This is not an open. This is society, as many have pointed out, that is for the oligarchy. 5 million. Who has 5 million to come? If you have 5 million, why would you go to the United States to invest? You can go anywhere. You can go to the United States and you don't have to invest the 5 million. So the absurdity here is that it's a society for the oligarchy, public policy for the oligarchy, at whose expense? Gutting Medicaid, Medicare, Social Security, Social Safety Net programs, federal employees thrown out so that billions, hundreds of billions in contracts. I had done a session on this a few weeks ago, and I noted then, by the way, without having with just having scanty evidence, that all of this is to reward Silicon Valley with multi-billion-dollar contracts for artificial intelligence and other computer programs in the federal agencies. And just recently, this was confirmed. That's exactly what they're doing. So who is really looting the healthcare system, and which is part, by the way, only part of it is in the social safety net program? Is it the poor? Or is it the billionaires who get the corporate subsidies and are part of the corporate welfare program? And now there's a $4.5 trillion tax cut program to give back to them, which is going to be settled on the debt, and it's going to drive prices even higher, lowering the value of the dollar globally. Already it's lost ground, by the way, because the stock market of the United States has not exactly done well since Trump took over. So what we're looking at here is the rich eating the poor. Literally, that old saying, the rich eat the poor, they're eating the poor. Through every sector, and the healthcare system is one of it, and private equity firms, which go in and decapitalize healthcare entities, everything from emergency rooms to entire hospitals, often driving them into bankruptcy, leaving the taxpayer, by the way, with the bill, and getting rewarded by the government, which government officials, the government elected officials, have been financed, their campaigns have been financed by these same people. This individual that Trump appointed is a longtime contributor to the, Trump appointed to the Defense Department, nominated for the Defense Department position as Deputy Secretary of the Defense Department, Feinberg. This is someone who is contributed to the, these people contribute. Elon Musk, the largest contributor, he's co-president. As many in Congress, I don't call him co-president, but many elected officials in the United States call him co-president. So what you have is this 19th century view of how capitalism must work. The capitalists go directly into government and seize the government and have direct exposure. The downside of that is the world sees who's running society. This is not a democracy. Bernie Sanders, Elizabeth Warren, many others are correct. This is a slope toward authoritarianism. This is a slope toward oligarchy. This is a slow slope down toward something that has nothing to do with a liberal democracy, let alone a social democracy. the future of the healthcare system in the United States for the short term is not good. This will continue, by the way. This rating of the healthcare sector, unchecked, for everything from drug companies receiving hundreds of billions in corporate subsidies and tax cuts from the taxpayer, and then turning around and price gouging the taxpayer. There's no reason insulin should sell $5, $10 in Portugal and $500 in the United States. There's no reason for that. It's the same insulin. The same company makes it. Yet it does. The government allows for that. And companies don't want regulation. That's a core value of the neoliberal mentality. No regulation. So they can move toward monopoly control. I should say oligopoly control, the way it was back during the era of cartels and monopolies in the late 19th century, when the robber barons were in charge of government, behind the courts, as we have today, behind local government, city government, state government, federal government. There were these rich people, a couple of thousand of them, by the way, in fact. They ruled. The rest had to endure this tyranny. We're back to that. That's the era. Back to the Gilded Age. Golden Age for the oligarchy. An era of authoritarianism and illiberal democracy for the rest of the population. In the next downturn, and it is inevitable, and I'm not just talking a recessionary cycle, which is built into the economy, by the way. I am talking about a deep cycle, contracting cycle of the economy, which is built into it, like the one in 2008, called the Great Recession. The next deep contracting cycle of the economy will see many people unable to afford critical medical health care. Many people with chronic diseases on medication, prescription medication, becoming unaffordable, will die. That is American democracy. Okay. And on top of that, okay, instead of addressing this issue the way that other advanced countries are addressing it, including China, by the way, which the US considers part of the axis of evil, yet that axis of evil country has a far superior medical healthcare system, I should say, a healthcare system in the United States in terms of serving its 1.5 billion people. Not 345 million, 1.5 billion. China, the axis of evil country. It's authoritarian, it's one-party state, but it has a healthcare system that serves. It aims to serve, I should say. It certainly has a lot of flaws in it. But it is much more widely available to more Chinese people in a percentage basis, okay, which have 8 times less in medical and consumer household debt than the American people, okay? So these are very important issues to consider. Sure, the rhetoric is fine. The US is the greatest country, the greatest democracy in the world. But the policies that it pursues are rooted in social injustice. I'm going to leave it there. I want to thank you for listening. I want to ask you to write questions, comments, and by all means, join this channel, which Asad Alim manages, and it's an educational channel, and that's all. It's designed to educate people interested in substantive issues. Thank you very much.